How do bladder muscles control urination? Imagine your bladder as a balloon that fills with urine over time. The process of emptying it involves a finely tuned system of muscles and nerves working together seamlessly. The main muscle involved is called the detrusor muscle, which lines the bladder wall. When your bladder fills, stretch receptors in the bladder will detect this expansion and send signals to your spinal cord and brain. These signals let your brain know that it's time to consider urination. Once the bladder reaches a certain level of fullness, the brain's micturition center in the brainstem sends a command to start the process of emptying. This command causes the detrusor muscle to contract, squeezing the bladder and pushing urine out. At the same time, two important sphincters regulate urine flow. The internal urethral sphincter, located where the bladder meets the urethra, is made of smooth muscle and is controlled automatically by your nervous system. When it contracts, it keeps urine from leaking out. When you're ready to urinate, signals from your nervous system cause this sphincter to relax, opening the pathway for urine to flow. The external urethral sphincter is different. It is made of skeletal muscle, which means you can control it voluntarily. This sphincter is controlled by the somatic nervous system and is innervated by the pudendal nerve. When you decide it's time to urinate, you consciously relax this muscle, allowing urine to pass through the urethra. If you need to hold urine, you contract this muscle to keep everything in. This entire process is a complex dance of neural signals. Sensory information from the stretch receptors travels up your spinal cord to your brain, which helps you become aware of your bladder's fullness. When you decide to go, your brain sends signals back down to your spinal cord, instructing the detrusor muscle to contract and both sphincters to relax. This coordinated effort allows urine to flow out smoothly. Maintaining the health of these muscles and their nerve connections is crucial for normal bladder function. Problems can arise if these muscles or nerves are damaged, leading to issues like urinary retention or incontinence. For people with bladder conditions or bladder cancer, understanding how these muscles work helps in managing symptoms and maintaining quality of life. So, in essence, controlling urination involves a delicate balance of involuntary muscle contractions and voluntary muscle relaxations, all guided by a sophisticated network of nerves and brain signals. Always remember, if you experience any bladder issues, consulting a healthcare professional is the best step to ensure proper diagnosis and treatment.